So having the pathogenesis of dilated cardiomyopathy. So first of all know what is a cardiomyopathy. A cardiomyopathy is a condition where there's a disease condition of the heart muscles. Then if you say there's a dilated cardiomyopathy, you are simply saying what the heart muscles, their size is the same, but the heart cavities are now becoming enlarged. Can you see this cavity? Can you see this cavity? This one is bigger than the normal one. Okay, so pathogenesis is usually what, like the stage by stage. What are the things that cause this, and how do the things act to cause a dilated cardiomyopathy? That's what you're trying to look at. So pathogenesis of dilated cardiomyopathy. First of all, let's define it. We said that dilated cardiomyopathy is a condition where the heart muscles become weak, but their shape is not changing. Like, let me say, like the individual myocytes, their shape is not changing. They are just becoming slacky. Okay, so they become weak and they cannot pump blood effectively. All right, so this would lead to what? A dilated or enlarged ventricle. You just say ventricle. All right, it mustn't be specific to say the left. Just say ventricles, right? So the pathogenesis of this dilated cardiomyopathy involves a complex interplay of factors. These are basically factors that led to what? A dilated cardiomyopathy and how they act. So it could be due to what? Some genetic mutations. All right. It could be due to infections. So the examples are by the side. You can read it. It could be due to some autoimmune responses. It could be due to toxins or drugs. It could be due to nutritional deficiencies. It could be due to what? Hormonal imbalance. It could be due to ischemic heart disease. Cardiac arrhythmias can also cause it. Mechanical stress can also cause it. Aging and oxidative stress can also be a cause of this, right? So these factors, summing one or two or three together, it can lead to myocyte damage and death. This will lead to fibrosis and scarring. It will lead to an inflammation and immune response. It will lead to mitochondrial dysfunction. There will be impaired calcium handling. All right. Then next there will be abnormal cell signaling and gene expression. Right. So instead of the muscles to now be competent, they will now be slacking. It's a dilated cardiomyopathy. See, normally see the heart cavities, see their shape or their size. Okay, so this is becoming like stretched. Okay, it's becoming slacky, right? So for this, it will result in what? All these interplays, all these factors will lead to this. Then this will lead to what? Ventricular dilation and hypertrophy, and there will be reduced contractility and the ejection fraction, like how the ventricles are pumping blood into either the lungs or into systemic circulation will be reduced, all right? And now there will be increased risks of what? Heart failures, arrhythmias, and there could be a sudden death, okay? So that's it for the pathogenesis of dilated cardiomyopathy.